Hi everyone, my name is Hannah Bay. I am a postdoctoral scholar at the Department of Surgery in the S-SPIRE Center. Thank you so much for the opportunity to present this paper. The title, Navigating Post-COVID Medicaid Policy Changes, the Rise in the Hospital Presumptive Eligibility while Medicaid Enrollment Unwinds in California. There is no conflict of interest. So as you know that the Medicaid is a critical source of healthcare coverage in the US, covering roughly 1 in 5 Americans. As a mean tested program, the program eligibility usually depends on the income and family size. So once a person enrolls in a Medicaid program after the 12 months initial enrollment period, if a person wants to stay in the program, it has to go through the annual renewal process. Because providing the right document on time and then preparing all the documents are time-consuming and very tiring process. Prior studies have shown that there's a large the procedure reason, which includes incomplete paperwork or missing paperwork, is a primary reason why so many eligible individual has to disenroll from the program and had to re-enroll it after they have all the documents ready. So related to this, by the federal government implemented a policy called the Federal Families First Coronavirus Response FRCRA, which mandated that states cannot disenroll individuals from the Medicaid program during the COVID pandemic. That is, once you're in the Medicaid program prior to the March 2020, you're allowed to stay in the program until the end of COVID pandemic. But once federal lifted this mandate in March 2023, now states are allowed to reinitiate this annual renewal process, such that, for instance, in California, the first disenrollment in Medicaid program happened in June 2023, and there was a federal report that provides that roughly 3.9 Californians are expected to disenroll from the Medicaid program during this Medicaid unwinding period. Well, while there has been a continued discussion on there might be an increase in the uninsured population as response to this Medicaid unwinding, but there has been a little evidence on the extent of this disenrollment and what will be the potential avenue that could help individuals who lost coverage during this unwinding period. So this study aims to address this gap by examining the policy called a program called Hospital Presumptive Eligibility, or HP, throughout this talk. So HP is a temporary Medicaid coverage that lasts up to 60 days, and an uninsured patient could get this coverage by going to a hospital that provides this HP to their patients. So roughly 1.3 Californians or ever enrolled in this program during 2019 to 2023, roughly 3.3 California populations. So, and this is the program that knows to be very important to the surgical population, where roughly 17% of this HP enrollee got HP through the trauma centers, and 23% actually were able to get surgery thanks to this program. And also, HP is known to be a very critical pathway to get the long-term Medicaid, because HP enrollee could get a support from the hospital staffs about how to get into to apply for the long-term Medicaid program while they're in the hospital. So by using the timing of this Medicaid unwinding, we want to answer the two research needs. First, we're gonna document the trends in the Medicaid enrollments around the time that the Medicaid unwinding took place, and we're gonna employ the publicly available data to estimate a linear problem model to identify which groups had a harder time to recertify to stay in the Medicaid program during the unwinding periods. Second, we examine also the trends in the HP enrollment around this time period, and then we use the uninterrupted time series model to estimate the changes in monthly HP enrollments and which group seems to have a rapid increase in the HP enrollment around the unwinding periods. And in order to do so, we work with the state government to get access data that allows us to see the whole anyone who ever got into HP from 2017 and 2023 in California. So let me briefly walk through the key findings of this paper. So this is the figure that shows the total monthly Medicaid enrollment happening in California, and it's in blue line. So as expected, at the time when the Medicaid, at the time when the federal government mandated the state to provide continuous coverage to the Medicaid enrollees, highlighted in this blue, there's a continuous increase in number of people who are staying in Medicaid. But as soon as the Medicaid unwind took place in California, which was June 2023, I'll highlight this yellow, there was a decrease in number of people staying in Medicaid, roughly like 19% decrease in Medicaid enrollment by the end of 23 compared to May 23, which was a month prior to Medicaid unwinding happening in California. So using this individual level data, we show that the likelihood of person retaining Medicaid coverage dropped by 4.6 percentage points during the unwinding period compared to the pre-unwinding periods. And then by using individual level characteristic, we show that this individual who are unlikely to maintain Medicaid coverage or tend to be individual living in states have a restricted HPE enrollment, and individual for young adults age 19 to 25, and they tend to be the ones have a relatively low health risk than the general population. So I would like to gear our attention towards the HP now, which is highlighted in this red line. So this shows how many people are in HP program in California each month. As you can see, there's a decreasing trend, but on HP enrollment at the time when COVID pandemic was present. But as soon as Medicaid unwinding took place, you can see a rapid increase in HP enrollments, average 2.7 increase per month, or 19% increase in the HP enrollment by the end of 2023 compared to pre-winding periods. So similar to what we just showed before, so the two groups tend to have a rapid increase in HP enrollment during this unwinding period, tend to be those who are younger adults and individuals who are living in counties, more marginalized populations, and they tend to be the ones who have a relatively lower health risk than the average populations. So to conclude, so you can see that the Medicaid, both Medicaid and HP enrollment was very responsive to federal policy changes about Medicaid. And our findings provide evidence that the HP does seem to act as a social safety net program by the time when the risk of losing coverage was very high during the winding periods. So due to time, I cannot go over what's going on, but since given the fact that the winding is expected to have a very big implication for the uninsured population, there's so many interesting ongoing studies happening at the Dr. Knowlton's lab. So I would love to talk more about this after talk. I thank you for listening.